Hi everyone, good morning. I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. In my previous video, I talked about the warning signs and symptoms of bladder cancer. So today, let's discuss renal cell carcinoma, also known as kidney cancer. So the most common type of kidney cancer is known as clear cell carcinoma. And clear cell carcinoma accounts for approximately 75 to 80% of all cases. There are other major subtypes, and those include renal cell papillary carcinoma, which is about 10 to 15% of the cases, chromophobe renal cell carcinoma, about 5%, and then there's other rare subtypes. In fact, the World Health Organization recognizes 20 of these malignant subtypes. So for kidney and what's called renal pelvis cancers, there's an estimated 81,600 Americans that were diagnosed in 2024 with 14,000 deaths. In 2025, the projections show about 81,000 new cases, 52,000 in males and 29,000 in females, and about 14,500 deaths. Globally, actually, there were 434,000 new cases in 2022, and globally the peak incidence occurs between age 60 and 70 with a male to female ratio of approximately 3 to 2. However, in the United States especially, we are seeing younger patients develop renal cell carcinoma. Now here's the scary part. Most renal cell carcinoma cases are detected incidentally on abdominal imaging, in other words, CTs for other reasons, or ultrasounds, up to 61% of the cases, as the retroperitoneal space, which in simple terms is the space behind the abdominal cavity, which houses several organs, including the kidneys and adrenal glands, can accommodate substantial tumor growth. In other words, the tumors could get huge before any symptoms develop. The classic triad of pain in your flanks, which is the sides, an abdominal mass that you can feel, and blood in the urine occurs in less than 10% of the patients. And when symptoms do occur, they may include gross blood in your urine, which is less than 25% of the patients, most common in advanced disease, bone pain or pulmonary symptoms like coughing or pain with coughing, and those people usually already have metastatic disease, and fever, weight loss, and anemia. Additionally, something called paraneoplastic syndromes occur in 10 to 40% of the patients, and that includes high calcium, high red blood cell count, and high blood pressure. Now, paraneoplastic syndromes are rare disorders where cancer cells release substances, and they can be hormones, antibodies, inflammatory mediators like cytokines that trigger an immune response that damages distant normal tissue and organs, causing neurologic, endocrine, skin, and other systemic symptoms. And these often appear before the cancer itself is found, and obviously then delays diagnosis. Unfortunately, there is no routine screening recommended for the general population. However, there is targeted screening in the rare cases for individuals with hereditary renal cell carcinoma syndrome. It's recommended that a genetic evaluation be done for individuals with personal or family history of renal cell carcinoma syndromes. The diagnosis at an age of less than 46 years old in a family member and syndromes features suggesting hereditary disease. Once that's confirmed, surveillance includes abdominal MRI, preferred over CT to minimize radiation exposures, with screening intervals defined by specific syndromes. For example, patients with something called hereditary leiomyomatosis and renal cell carcinoma require imaging starting in childhood, while those diagnosed with a rare syndrome called Birt-Hoag-Dubé syndrome begin screening at age 20. While screening for renal cell carcinoma could potentially be cost-effective in high-risk populations, uncertainties remain regarding optimal screening modalities, which population to target, and you need to balance the benefits versus the harms involving overdiagnosing people, which, majority of them don't have it. So with that, I hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or a consultation by me, you can go to our website at www.paladinmds.com, and I hope you have a good day.